the new medical school there. And then I completed my training with my neurology residency down at the University of Miami and Jackson Memorial Hospital.
The largest hospital in the U.S. just came out.
Is it?
Yes.
Oh, yeah.
I've shared that a couple times.
Oh, yeah. So it's
a very busy hospital.
I wasn't aware that it was the busiest, but I knew
over
it was
1,600 beds,
busiest.
I think.
Yes, it's big, and we saw a lot of neurologic problems and a lot of disease, even from other countries. People would be flown in to University of Miami so that we could see them.
That's one thing about Miami. It's 4.2 million people, but it is a hub. People who don't live down here don't really realize that, but we got a lot of Caribbean, South American, Mexico, everywhere comes to Miami.
Yep.
It's
Europeans even too.
Yeah, so you see a little bit of everyone. So that is great training. And wow, your education, Cornell, UCF, Johns Hopkins. I mean, wow, that is great. So you're
I've been very lucky.
Yeah, that is great. So let's get right into it. All these areas of interest that, neurologists have. Let's start with the big one, stroke. It seems more prevalent than ever. Tell us a little bit about the difference between the two main types of stroke.
Sure. So the two main types of stroke are ischemic stroke or hemorrhagic stroke. So just to give a broad overview, stroke is when you have decreased blood supply to the brain, to a part of the brain. Ischemic stroke is when you have decreased blood supply to the brain because of a blockage, like a blocked artery, whereas a hemorrhagic stroke is decreased blood supply to a part of the brain because of a bleed. So most strokes are ischemic strokes. They can present, both types of strokes present in the same way, but most strokes are ischemic strokes.
Yeah, did I read somewhere recently as much as like 85% are ischemic and like 15% are hemorrhagic? Does that seem kind of right?
Yeah. Mm-hmm.
Like I may be a little off there. I don't want to put you on the spot, but I did read that recently. So what to do? It's kind of hard to know sometimes if you're having a stroke, right? So friends, family members should also know some of the symptoms. Let's start, I guess, first with the symptoms. What are some of the symptoms of these strokes?
So the main important thing that people should be aware of is that if you are having sudden symptoms, that come on suddenly out of the blue, out of nowhere, and it could be really anything, then you need to be thinking, is this a stroke? The most common mnemonic that's out there is FAST, F-A-S-T, FAST. F is for face. If the face is asymmetric, if there's a facial droop. A is for arm. You have the person put both of their arms up like this and see if one of them starts to kind of fall, then there might be a difference in strength there. S is for speech. You have them either talk, or if they have a problem understanding what people are telling them, either or could be a symptom of stroke. And then T is for time. And that's not a symptom of stroke so much, except for the suddenness that I just mentioned, but it's more of an emphasis to call 911 or go to the ER immediately, because there are so many treatments now for stroke that are only able to be given if the patient comes in within a few hours of their symptoms starting. So if you wait it out and try to see, is this going to go away, you're probably not doing the best thing. So if you have any sudden onset of symptoms, facial droop, arm or leg weakness, speech changes, sometimes it's dizziness or double vision, things like that, anything that's relating to a single part of our of our mental capacity, I guess I should say, if that makes sense, then you should be considering stroke and call 911 or go to the ER immediately.
Yeah, that definitely makes sense. That's a great explanation. I've even heard a couple, when people are doing kind of weird things. I once did a testimonial on a woman who, she was reading a pizza box upside down and her son noticed. He was like, what is going on there? Mom, you all right? Yeah, I'm fine. Just can't figure out and then he was like, uh-oh.
Confusion.
And he grabbed the pizza box and he grabbed her to sit down and he called 911 and they got her to the nearest hospital, that, whatever stroke they determined it was in the ambulance, and she got the help she needed. And I don't think she had, when I talked to her, any side effects. So that's great. It's all about, like you said, time and that FAST acronym. We're here with Dr. Renata Chalfin. She's a neurologist right here in Boca Raton, board certified, Ivy League trained. Office location 7280, so 7280 West Palmetto Park Road, Suite 104, Boca Raton. Office hours, very convenient. Pretty much, every day of the week there.
Except for Fridays.
Except for Friday. That's okay. I mean, you're busy the other days, and the number 561-961-8575. So, Dr. Chalfin has an amazing website. It's idealneurology.com. So the word ideal, IDEAL, and then neurology.com. Check it out. It's great. Ton of info there. You can find out more information about her practice and her areas of interest. We're also on Facebook Live. I just saw it go up. We're here on the radio. So if you're listening, number's 1-888-565-1470. If you have any questions, that's 888-565-1470. 1470. Dr. Chalfin, do women and men have different symptoms or actually, we talked about symptoms. So do women and men, what can they do is there any difference in what they can do for stroke prevention, or it kind of ties hand in hand? That's what I was getting to. Thank you.
So stroke prevention is obviously a hot topic because stroke is so prevalent, but thankfully it dropped down. It was the third leading cause of death just a few years ago, maybe 5 years ago, and now it's dropped down. I don't remember the exact number, like seventh, because we've been getting a lot better at recognizing the symptoms and treating it. So to answer your question as far as prevention of stroke, we know that high blood pressure, high cholesterol, diabetes, those are the main things. The American Heart Association released a public health campaign called Life's Simple 7, which are the 7 important things that people should focus on to get their heart and brain healthy. So the 7 things are eating healthy, staying active and exercising at least 150 minutes a week, losing weight, not smoking, controlling their blood pressure, controlling their cholesterol, and keeping their blood sugar under control as well. So those are the 7.
That's not too much to ask.
I know.
Definitely.
Well, I mean, they try to simplify it. Nowadays there's a lot on the internet and everything with take this supplement, take that supplement, see this kind of doctor, that kind of doctor. I think, to really simplify things and just focus on the big things, your diet, your exercise, those are the main things.
That is great info. Life Simple 7. I jotted that down, as you saw, because I've been pretty healthy this year, working on a lot of things, so I hope everyone else does. Check it out, because Dr. Chalfin brought us that great info. One more question on stroke, and we're going to get to all the other areas of interest that you treat. Well, not maybe all of them, but some of them. Are you seeing it more prevalent in young people?
I don't think that I'm seeing it more prevalent in young people, but I do think that we're getting better at recognizing the symptoms. So again, young people that might have come in with symptoms before, focal symptoms, we might have labeled as headache or crazy or something, and now we're able to find that they actually had a stroke. But I think the prevalence of stroke in young people, to my knowledge, has been around the same. The risk factors in kids or younger people, like we say young for stroke is under the age of 60, are if they have a genetic predisposition, like if they have a blood clotting disorder or something like that in their family, sometimes they're at risk for stroke. Also, smoking increases the risk of stroke in young people. Taking birth control in women, especially women with migraine with aura, can increase the risk of stroke in younger women.
Well, Dr. Chalfin, hold that thought, because on the other side, we're going to talk about neurologic issues in women on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. All County Healthcare has exciting longer news for any and all an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show, living a longer and healthier life. We're here with Dr. Renata Chalfin, neurologist, board-certified neurologist, Ivy League trained at Cornell, Johns Hopkins as well, UCF Medical School. Did I get that right? Mm-hmm. So what was Johns Hopkins, the residency or fellowship?
No, neither. That was my graduate program where I started a PhD program and realized my love for medicine.
Oh, okay. That's fine. Well, you're in the right place, definitely there. Let's talk a little bit about neurologic issues in women. So it's a little different between men and women, right?
Yeah. And I think it's important for women with any neurologic issues to find the right doctor for themselves, because their neurologic issues have to be addressed in a unique way. So, for example, certain migraine medications might interact with birth control pills, or they may be dangerous for an unborn baby if the woman becomes pregnant. Or same thing with medications for epilepsy or seizures. A lot of them have interactions with other medications, with birth control pills. They can have dangers for the unborn baby. There are certain medications that are safer than others. Or sometimes the symptoms that they're having may be, associated with their menstrual cycle. So all of these things should really be taken into account when a woman sees her doctor for, of course, any condition, but especially neurologic conditions.
If women have questions, they need a referral to see you, or they can just come by the office and it's normal like seeing a primary care?
Yeah, they don't need a referral. So they can just call the office and make an appointment, or they can actually book online on my website as well.
And the website is idealneurology.com, IDEAL, neurology.com. Mm-hmm. The phone number is 561-961-8575. Dr. Chalfin is conveniently located here in Boca Raton. That's great. 7280 West Palmetto Park Road, Suite 104. Right here in Boca Raton, office hours Monday through Thursday. Mm-hmm. Okay, I got that right this time. And I'm going to get this right too. You did your residency at Jackson.
Yes.
And Memorial Hospital in Miami. Correct. Sorry, I fudged that before. But we got it right. That's what we do. Mm-hmm. So piggybacking on the neurologic issues in women, mm-hmm. I know this is a question you get almost every day in your office. Headache and migraines, like people coming in left and right. I mean, I know so many people with headache issues.
Yeah.
And I always tell them, go see a neurologist, because, there are so many things that they can do. It's not all about Botox. It's not about this and that. They're going to manage you and find out what. Right, every case is different, right? So
yeah.
So let's get right into headaches. My question is, I'm always confused. I've asked this to doctors before. Is a headache a migraine? Is a migraine a headache? I mean, what's going on there?
Yeah, so a lot of people come in and say, oh, I don't have migraines, I just have headaches. And really, a migraine is just a type of headache.
Okay.
People consider migraines as a severe or a special type of headache. Really, it is a special type of headache. It does tend to be more severe than, say, a tension headache. But just because a headache is severe doesn't make it a migraine. And there are a lot of different causes of headaches and severe headaches. Migraine and tension headaches are two of the primary headache disorders, which we call them that because there's no underlying cause. But if you're having new headaches or your headaches are becoming more frequent or more severe and they're changing in some way, then you want to make sure you see a doctor to rule out a secondary headache, which means a headache caused by some other underlying condition, whether it be, God forbid, a brain tumor or increased pressure or, multiple other reasons.
Of course, yeah. So if someone has a sudden onset of headaches or just questions about headaches, it's time to see a neurologist, correct? Like,
yeah,
get in there and...
If you have a sudden onset of a headache that reaches a peak within an hour, then you may actually need to go to the emergency room. There are certain red flags for headaches that, we are concerned for bleed. If someone has a sudden thunderclap headache, it's called, or if they have fevers with their headache or rigidity of their neck, we are concerned for meningitis, things like that, then you probably need to go to an urgent care or an emergency room. But if you have been having headaches that have been bothersome that have not changed suddenly but have changed from how they used to be, definitely see your doctor. And there are a lot of things that can be done for that.
That's great info. I mean, where else are you going to get all this info from a neurologist? Experienced, Ivy League trained. This is amazing. We're here with Dr. Renata Chalfin. Idealneurology.com is the website. Again, the number's 561-961-8575. Right here in Boca Raton on Palmetto Park Road, 7280 West Palmetto Park Road, Suite 104. Keep giving that out. Definitely, if you have any neurological issues, go see Dr. Chalfin because she is definitely on point as an experienced neurologist here. So another issue, and I jotted this down. My grandmother had vertigo. I never knew what she was talking about until I, got kind of in the medical field as a, public relations writer. And then I know some people recently with dizziness issues, and that's another. These are tough things to try to live a quality of life with. So, do you see a lot of dizziness and vertigo in your office, in your practice?
Yeah, absolutely. Dizziness can be caused also by a lot of different conditions. As I mentioned earlier, stroke can sometimes cause sudden onset of dizziness, but also inner ear problems. Migraines themselves actually can come with some dizziness. Sometimes it's as simple as being over-medicated on on blood pressure medication or other types of medication that can lower the blood pressure. That can cause dizziness as well.
You say a lot about medication management. Do you do a lot of that too? Because you work people up. You got a whole file on them. You got looking at what they're taking, what's going into the body, etc. That's important.
Yep.
Because I always go to my what I know, and I know people who are on a lot of medication. The combinations can cause a whole bunch of effects, and it sounds like other ailments. So yeah, definitely find a neurologist like Dr. Chalfin or go to her office yourself and get a workup and just see what's going on if you have any of these neurological ailments. Dr. Chalfin, we still have a few more minutes. I want to give out the info again. If you want to call in, 888-565-1470. we'll get you on quickly. Or as you know, you can always find this show on allcountyhealthcare.com's page. There's a radio tab they put up. Thank you for doing that. Or, I see you guys on Facebook. I see all the viewers. Facebook.com. It's All County Healthcare. Just plug that in. I think it's Facebook.com/All County Healthcare. So there's a lot of places you can go to kind of use this as a resource. We're tackling a lot of topics. So this is great. Let's get right into a couple more. We got 2 minutes left. Let's do a minute on Parkinson's disease. What is it, and how does a neurologist help?
So Parkinson's disease is a neurodegenerative condition. Basically, certain cells in the brain are degenerating, and that results in slowness of movement, rigidity of movement, and tremor in some people as well. And there are lots of different medications and solutions for Parkinson's that a neurologist can prescribe, and exercise actually is one of the biggest things that's known to at least help delay the progression of it.
Exercise the body, exercise the mind, right?
Mm-hmm.
That's what neurologists will tell us. That's great. Last question. Should people get a flu shot?
Yes,
Put you on the spot.
Yes, of course. Absolutely. People get concerned about neurologic complications of the flu shot, but the risk of that is much lower than the risk of complications from the flu itself. So best thing is to get your flu shot and decrease the spread of flu to immunocompromised young people, older people.
Great info, Dr. Chalfin. Again, it's Dr. Renata Chalfin, idealneurology.com, 561-961-8575, 7280 West Palmetto Park Road, Suite 104, Boca Raton, accepting Medicare. She does house calls, too. Yep. Dr. Chalfin, you were great. We'd love to have you back on in the future.
Thank you so much.
And thank you for listening to the You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program